if we compare the different type of lung cancers, like here, adenocarcinoma and small cell lung cancer, we can see a statistically significant difference. So if we want to design a study, a clinical study, we have to consider the data of which are different in the survival of different kind of lung cancers. So here you can see a statistically significant difference. Can you hear what I say? Okay. And we could find something else when we analyzed people in different age groups. We could find a difference. It seems that younger people live shorter after the diagnosis having lung cancer. Medical doctors say that this is normal because in older people the tumor can grow slower. So you can see here the difference, and this is a statistically significant difference. Okay, only one slide. Okay, what is in the background of lung cancer and the action of deuterium depleted water? We could find earlier that deuterium depleted water has an impact on gene expression of proto-oncogenes and tumor suppressor genes, which can drive and break the cell cycle. And here you can see when animals drank 150 ppm water and 25 ppm water, and they received also DMBA, dimethylbenzanthracene, which is a carcinogenic agent, and it can cause the increase of different kind of proto-oncogenes. You can see the diminish of expression of proto-oncogenes here, and in case of treatment with a carcinogenic agent, the column is still low in case of 25 ppm consuming animals. Okay, thank you for your attention.
Any question?
It was surprisingly large difference between the female and the male groups. Yes. In the small cell cancers group. What do you think is the reason, about the reason? Yeah. Because it was so large difference.
As I told you, the size of the group was not too high. So the number of people, and maybe there is an error. But you could see in other type of lung cancers that there is a big difference if we compare the different sexes. Maybe in case of small cell lung cancer, we can see the same difference, the same huge difference in following studies. So that's why I wanted to show you the slide. Maybe it is an interesting when we design a study.
I was making one comment. I think one number was missing. That statistically was based upon 130 lung cancer patient, and then okay. From that 130 he made the subgroups and calculated. And the other reason could be with the male and female, that the females are more precise. The males are not consuming so properly the deuterium depleted water because the beer is very, very nice. They like it.
So yes, this is a problem that they don't drink regularly the water. So.
Somebody else?
I think some of the lung cancer cells are hormone-producing cancers. At least in the lung, it's very common. that we find these epidermals or kind of closed loop hormones secreting tumors. So I think part of the answers may be just related to the hormonal background and the hormonal control of
Yeah,
tumor
I'm sure
cells
it has a
in female
big
and male
influence. Yeah, the hormone status of patients has a big influence on the tumor appearance and the tumor growth after that, and the sensitivity to the regular therapy or the therapies like deuterium depleted water.
Any other questions, comments? If I may, I would like to ask you, have you ever been to a, let's say, traditional congress of oncologists or pneumologists with those data?
So there was no big discussion.
No, because it would have been interesting to know what do they think, people that really work with cancer.
Yes.
And a nice comment, seeing that dimethylbenzylanthracene is one of the most deadly poisons in the tobacco smoke. If we drink enough water this we can smoke?
No.
I think
Seems, yes.
the biggest effect would be if you could sell it together with the packs of cigarettes, and then it would be perfect.
If you suddenly drink one bottle of 25 ppm deuterium depleted water. Okay, thank you.
So I'll invite Dr. Schomler to